The IMpassion130 trial is a randomized phase 3 trial that was set up to test whether the addition of the immune checkpoint inhibitor Atezolizumab to standard chemotherapy could improve outcome in patients with metastatic triple-negative breast cancer. The trial was designed to randomize patients between nab-paclitaxel chemotherapy and placebo, or nab-paclitaxel chemotherapy and Atezolizumab. The trial had 4 primary endpoints. 2 primary endpoints for progression-free survival, both in the ITT population, intention to treat population, and then in patients with PD-L1 positive tumors as well. PD-L1 positivity was defined as at least 1% staining by immune histochemistry on immune cells. The other 2 co-primary endpoints were overall survival in the intention to treat population as well as in the PD-L1 positive population. 902 patients entered the trial. What we presented here at ESMO 2018 were the final data for progression-free survival and preliminary data for overall survival based on approximately 60% of the required events. We were able to show that the addition of Atezolizumab to standard chemotherapy significantly increased progression-free survival both in the ITT population and in the PD-L1 positive population. The hazard ratio in the ITT population was 0.8. The hazard ratio in the PD-L1 positive population was 0.62, which was a substantial improvement in progression-free survival. Looking at overall survival, at this time point there was no significant difference for patients in the ITT population according to the pre-specified criteria. However, looking at overall survival in patients with PD-L1 positive tumors, there was an increase in median overall survival from 15.5 months to 25 months, which is a hazard ratio again of 0.62. Safety was relatively comparable between both treatment groups. There was a slight increase in toxicity in keeping with what we know from the single agent activity or single agent toxicity for Atezolizumab and nab-paclitaxel. Overall, this is the first phase 3 trial to demonstrate a benefit of immune therapy in breast cancer. It is also the first phase 3 trial that demonstrated a substantial overall survival benefit in metastatic triple-negative breast cancer for a targeted therapy. The trial clearly showed a benefit in progression-free survival. Most of the benefit, or almost all of the benefit, was seen in patients with PD-L1 positive tumors. This is 40% of patients with metastatic triple-negative breast cancer. We clearly still have to find better treatment options for patients with PD-L1 negative tumors, but for me this is a significant step forward, establishing immune therapy in the treatment of metastatic triple-negative breast cancer, which gives me a lot of hope for the future.